Human immunodeficiency virus, or HIV, is a virus that attacks the immune system and can lead acquired immunodeficiency syndrome, AIDS. HIV primarily transmitted through certain body fluids, including blood, semen, vaginal fluids, and breast. Understanding the modes of HIV transmission and the symptoms of the infection is crucial in preventing its spread and ensuring timely diagnosis and treatment. One of the most ways HIV is transmitted is through unprotected sexual contact with an infected person. This includes vaginal, anal, and oral sex. Individuals who engage in unprotected sex with multiple partners or have a history of sexually transmitted infections, STIs, are at an increased risk of HIV transmission. It is important to use condoms consistently and correctly to reduce the risk of acquiring or transmitting HIV. Another important mode of HIV transmission is mother-to-child transmission during pregnancy, childbirth, or breastfeeding. With proper prenatal care and the use of antiretroviral medications during pregnancy and delivery, the risk of mother-to-child transmission can be significantly reduced. It is essential for pregnant women to undergo HIV testing and follow the recommendations of healthcare providers to prevent transmission to their babies. HIV can also be transmitted through sharing needles or other injection drug equipment with an infected person. People who inject drugs should always use clean needles and syringes to reduce the risk of HIV and other bloodborne infections. Additionally, healthcare settings must adhere to proper infection control practices to prevent HIV transmission through contaminated needles or blood transfusions. Although HIV does not present with specific symptoms in the early stages of infection, some individuals may experience flu-like symptoms, such as fever, fatigue, swollen lymph nodes, and sore throat. As the virus progresses and damages the immune system, more severe symptoms may appear, including recurrent infections, weight loss, diarrhea, and opportunistic infections. It is important to seek medical care if you think you may have been exposed to HIV or are experiencing symptoms suggestive of the infection. Testing for HIV is the only way to know your status and access treatment if needed. Early diagnosis and treatment with antiretroviral therapy can help people with HIV live long and healthy lives. Routine HIV testing is recommended for all individuals, particularly those who engage in high-risk behaviors or have potential exposure to the virus. In conclusion, understanding the modes of HIV transmission and being aware of the symptoms of infection is essential in preventing the spread of the virus and promoting early diagnosis and treatment. By practicing safe sex, using clean needles, and getting tested regularly, we can work together to combat the HIV/AIDS epidemic and protect our communities.